The objectives for this module are to describe different types of team leaders, describe the roles and responsibilities of an effective team leader, describe the leader's role in resource management, describe the delegation process, describe strategies for team leaders to use, including briefs, huddles, and debriefs, describe how effective team leaders facilitate conflict resolution, and identify the barriers, tools, strategies, and outcomes of leadership. Leadership is essential to holding a teamwork system together. Effective leaders create the climate that allows teamwork to thrive. The actions of leaders are intimately linked to the other three essential elements of teamwork. First, leaders must frequently monitor the situation to better anticipate team members' needs and effectively manage the resources to meet those needs. Second, leaders must communicate effectively with their team members to model appropriate behavior. The leader must then reinforce and reward that behavior when it is exhibited by team members. Third, leaders must foster an environment of mutual support by role modeling and reinforcing the use of those types of behaviors. Leaders also have a responsibility to support the patient care team. Leadership has been identified by team researchers as an important piece in the teamwork skills puzzle. Solis and colleagues point out that leaders impact the team effectiveness not by handing down solutions to teams, rather by facilitating team problem solving through cognitive processes, coordination processes, and the team's collective motivation and behaviors. Team leaders are well-informed team members who make decisions and take actions. Team leaders establish the goals of the team and help maintain its focus. There are two types of leaders. The first type is the designated team leader. For a team to function effectively, a leader must be designated. This leader must possess the knowledge, skills, and attitudes to achieve the established goals. The second type is the situational leader. Designated leadership may change depending on the flow of the case. Situational leaders emerge at designated times, such as during anesthesia induction or at spontaneous times, for instance, in a code. In effective teams, any member of the team with the skills to best manage the situation can assume the role of situational leader. Once the situation has been resolved or the designated leader is ready to assume control, the situational leader again assumes the role of a team member. Think of your unit. Are there any designated team leaders on your unit? Is the role of team leader acknowledged and understood by team members? How do leaders' roles change from situation to situation? And can the roles of the designated leader and situational leader be better defined on your unit? Team leaders must hold a set of effective skills regardless of the type of team that they lead. Team leaders should be able to effectively organize the team, articulate clear goals, make decisions based upon the input of team members, empower team members to speak up and openly challenge whenever appropriate, promote and facilitate good teamwork, and resolve conflict. Evidence also suggests that effective team leaders are responsible for ensuring that team members are sharing information, monitoring situational cues, resolving conflicts, and helping each other when needed. Team leaders manage resources to ensure team performance. They facilitate team actions by communicating through informal exchange sessions. They develop norms for information sharing, and they ensure that team members are aware of situational changes to plans. Resource management is the active handling of resources available to teams. These resources can include time, people, equipment, and information. The goal of resource management is to make the best use of all available resources to increase situation awareness among team members and decrease the risk of error. Resource management is a key component of team leadership. The current slide illustrates the responsibilities of the core and the coordinating team leaders in managing resources. Management of resources within the department and across teams is primarily a function of the coordinating team leader. The core team leader manages resources within the team. Some methods of resource management may include determining available resources and requirements, prioritizing tasks that need to be completed, collaborating within or across teams to develop a plan for the use of resources, anticipating potential problems with the plan, and revising the plan as necessary. Think about your unit. How do your unit team leaders handle the items listed on the slide? What has been effective and what has not been effective? Delegation is a method of redistributing tasks or patient assignments. It can occur within and between teams and be utilized across all role groups depending on the task requirements. There are 4 steps to the delegation process. First, you must determine what to delegate. Consider priorities, work requirements, and the availability of resources. Second, determine to whom to delegate. Consider their skill level, their availability, and their scope of practice. Third, communicate clear expectations of what needs to be done. Communicate the plan as well as the task to be completed. And finally, request feedback. Verify task completion and outcomes, and recognize achievement. To be effective, team leaders must model the behavior that they would like their team members to perform and reinforce those behaviors. Effective team leaders encourage desired team behaviors and skills through facilitating information sharing. This can be done by utilizing briefs, huddles, and debriefs. They facilitate mutual support by delegating tasks. They facilitate conflict resolution by providing constructive and timely feedback. They facilitate situation awareness by identifying important aspects of the plan and by conducting briefs, huddles, and debriefs. They serve as a role model by effectively role modeling the desired teamwork behaviors and skills. 3 strategies that team leaders can use to promote teamwork are briefs, huddles, and debriefs. Briefs are held for planning purposes. During a brief, which is sometimes referred to as a team meeting, the designated team leader is responsible for organizing a 3 to 5 minute brief to discuss essential team information. The following information should be discussed in a brief. First, team membership and roles. Who is on the team, and who is the designated team leader? Second, clinical status of the team's patient. The current condition, diagnosis, plan, and status of each patient assigned to the team are reviewed. Third, team goals, pitfalls, and barriers. What is to be accomplished, and who is to do it? Fourth, issues affecting team operations. Resources normally available that may be restricted during the current shift. Performance goals are an intrinsic part of the team's purpose. Successful teams measure their effectiveness in terms of goal achievement. Performance goals are typically established during the team brief. The designated team leader facilitates the process, and the team members actively participate to establish both clinical and teamwork goals.
Okay, she currently only has intermittent late decelerations, and these have improved with her position changes and supplemental oxygen. We'll monitor her until she's fully dilated and allow her to push. If there's any evidence of fetal distress or persistent late decelerations, we should be prepared to go to C-section.
I've alerted the OR to be prepared in case we need to use it.
Great. I'll discuss this plan with Mrs. Keys when we're done here. What are her vitals right now?
Normal, just checked 15 minutes ago.
She's had no late deceleration since you recall.
Well, let's continue to monitor her. I need to know when she's complete and pushing so we can keep a close eye on her second stage. Any questions?
Now let's discuss the video. Who is the team leader? Dr. Upton. He set the tone by coordinating the brief and creating a shared mental model with the entire team. Did the team develop a comprehensive plan for Mrs. Keys? Yes. Dr. Upton sought input from all team members before communicating the care plan. Team members were well aware of their roles and responsibilities and were eager to share information, and questions were encouraged. Did the team address contingencies, and was the patient included in those discussions? Yes. The team understood what specific behaviors could lead to C-section, and Dr. Upton made plans to communicate that information to the patient. Planning is an important first step in understanding who is on your team, what needs to be done, and any issues that need to be resolved or considered in order to operate. The team leader usually initiates the planning process, but any core team member can do so. Team members are included in the planning process or are informed of the team's plan. Planning ensures that team members have a common understanding of the plan of care and any potential problems, along with an understanding of their roles in carrying out the solution. Involvement of all team members in the planning process is essential because team members need to know what is going on, where the team is headed, and what tasks need to be performed. Similar to a pre-flight checklist used in aviation, during a brief, the team leaders should cover the items on a checklist. As in aviation, the briefings done before flights provide the ideal forum for building a team dynamic that allows everyone to work together when carrying out routine tasks and when tackling unexpected problems. Briefs serve the following purposes. They clarify who will be leading the team so that others know who to go to for guidance. They open lines of communication among team members, ensuring that everyone can contribute their unique knowledge base to the task, and thereby set the tone for the upcoming procedure. Protocols, responsibilities, and expected behaviors are discussed and reinforced so that possible misunderstandings are avoided. They prepare the team for the flow of the procedure, contingency plans, and the means for resolving any unusual circumstances. By delineating expectations, they reduce disruptive or unexpected behaviors. The huddle is a tool for reinforcing the plans already in place for the treatment of patients and for assessing the need to change plans. It serves as a tool for developing shared understanding between team members of the plan of care. It also provides team leaders with an opportunity to informally monitor patient and unit-level situations. Information will change over time, and that will require monitoring and updating of the team. Note that a sudden increase in the activity level of an individual or the team indicates the need to reevaluate workload status. Workload distribution may need to be adjusted on the basis of this information. Information updates within the team should occur as often as necessary. Updates can take the form of a huddle at the status board or can occur between individual team members whenever new information needs to be shared. Here's an example. The ICU Green team has 4 patients on a very busy evening shift. During a huddle, the team leader decides that patient A can be transferred to the step-down unit if his ABGs after extubation are acceptable. The team is also alerted about an elderly patient with severe pneumonia being admitted from the ED.
Yeah, here's his electrocardiogram.
Well, this looks like it could be an acute MI. All right, everybody, hey, let's huddle up before we go in so we know what we need to do.
Well, I've got the 4 liters O2 by nasal cannula and 2 aspirins. He's hypotensive, so we might want to drop the nitro. He's already on the monitor.
Good catch, Karen. Hold the nitro. Where are his cardiac labs?
His labs are pending. We should have those in 15 minutes.
Okay, let's prepare to get him to the cath lab immediately.
I'll call the cath lab to confirm.
Okay, all right, let's get in there.
Let's discuss the video. What event necessitated the need for the huddle? The patient's EKG indicated a possible acute MI requiring additional team action, planning, and coordination due to the emergent nature of the patient's condition. What key information was shared in the huddle? Most recent patient history and current status, distribution of task and workload, and emergent plan of care. Huddles provide team members with an opportunity to update each other on emerging or significant changes in the status of the environment, so all team members can adapt appropriately. Debriefs include precise recounting and documentation of key events, analysis of why the event occurred, what worked and what did not work, a discussion of lessons learned and how they will alter the plan next time, and an establishment of a method to formally change the existing plan to incorporate lessons learned. Debriefs are most effective when conducted in an environment where honest mistakes are viewed as learning opportunities. Debriefs should be the subject of a brief, about 3 minutes or less, team event typically initiated and facilitated by the team leader. Debriefs are most useful when they relate to specific team goals or address particular issues related to recent actions of the team. Debriefs also maintain effectiveness by not assigning blame or failure to an individual. Although the debrief is meant to be a process improvement tool, at times it may be necessary to conduct a complete process review and system redesign if the same issues or events continue to reoccur. These reoccurring issues may be identified during a debrief and could then be mapped out and accessed at a designated time in the near future. While you strive to have a flexible and adaptive team, be cautious of creating workaround processes to accommodate certain issues. Here's how to conduct a debrief. Facilitate the discussion as a leader by asking questions related to team performance. What did we do well? Recap the situation, background, and key events that occurred. As a team, assess how the following played a role in the performance of the team: team leadership, situation awareness, mutual support, and communication. Then summarize lessons learned and set goals for improvement. This checklist can be used by the team during a debriefing to ensure all information is discussed. Dr. Upton leads the labor and delivery team debrief immediately following a procedure. He facilitates the discussion among team members who have an opportunity to share lessons learned and valuable feedback with the entire team.
Great job, everyone. Can we discuss how things went today with Mrs. Keys? What did we do well, and what can we do better next time?
It was helpful for me to be brought in early. That allowed me to use a regional instead of a general anesthesia.
You're right, Grant. Lynn, what did you think?
It was great that Dr. Dean helped put the Foley in place while I did the count with Alicia.
Albert, this is a great example of task assistance. How was our communication today?
Excellent.
Now, what were some of the positive effects from this debrief? Team members shared best practices that improved individual and overall team performance. All team members were encouraged to participate. Reinforced teamwork skills produced good outcomes. Staff were able to self-learn and provide juniors with a teaching opportunity. Describe the tone Dr. Upton set for the debrief. He set a positive tone for open communication. He encouraged feedback. He facilitated lessons learned and reinforced team behaviors and successes with the team. Conflict is inevitable and can be caused by differences in clinical knowledge, work approaches, values, opinions, or personality. Resolution of conflict is necessary in the delivery of safe, quality care. Leadership skill in conflict resolution can enhance team effectiveness and performance. An effective team leader does not allow interpersonal or irrelevant issues to negatively impact the team. Now that we've discussed the importance that leadership plays in creating positive teamwork outcomes, let's watch the entire case of 27-year-old Mrs. Keys under the care of a team that utilizes effective and timely leadership strategies, including briefs, huddles, briefing checklists, conflict resolution, and debriefs.
Okay, so I spoke to Dr. Upton earlier tonight. He said Ms. Keys is a 27-year-old prima gravida at 41 weeks. Her cervix is 1 centimeter, 25% effaced, and -3. Her first blood pressure in the clinic today was 141/88, but the repeat was normal. He wants to induce labor with misoprostol intravaginally. I think he wants 100 micrograms.
Actually, Dr. Dean, I see the order says 25 micrograms misoprostol intravaginally.
Oh. Right. It is 25 micrograms. Good catch, Dr. Pond. There are no other complications that I'm aware of, but I'll review her obstetric record and check back with the team. We'll need to keep an eye on her blood pressures. She could be developing preeclampsia. Janet, who's coming in for you?
I'm handing Miss Keys' care off to Dana Collins. I'll make sure to mention your concern for her potential to develop preeclampsia.
Hi, Janet. How are things looking tonight?
Hi, Dana. I am late to pick up my kids at the center, so I need to make this quick. Doctors Dean Pham and I just had team huddle on Miss Keys. She's a 27-year-old prima gravida who's had an uneventful pregnancy. She's just been admitted for induction at 41 weeks with an unfavorable cervix. Poor thing has been waiting for a bed since early this afternoon and just got admitted.
That long, huh?
Yeah. She's stable right now. Dr. Upton's the attending. Doctors Dean and Pham are on service for her tonight. The plan's to induce by 25 micrograms of misoprostol intravaginally. Oh, and there's something you need to be aware of. Her blood pressure was elevated in the clinic, but they're high normal here, so we just need to keep an eye on it.
We're doing a stat section in room 15, and I need your help moving the patient to the OR. Okay, I'll be right there. So I'll keep an eye on the pressures. It looks like I got to run.
Okay, bye.
Dr. Pham, could you please come here now? She's having some painful contractions, and I'm concerned about some late decelerations on the fetal heart rate tracing.
She's at 6, Dr. Dean. Think we should call Dr. Upton?
It's early yet. I think we can manage this without him.
Dr. Dean, I'm concerned about Miss Keys. I'm uncomfortable watching these late decelerations, the baby's heart rate's in the 60s. I mean, I just don't think it's safe to continue labor.
Okay, Dana. Let's page Dr. Upton.
Okay, she currently only has intermittent late decelerations, and these have improved with her position changes and supplemental oxygen. We'll monitor her until she's fully dilated and allow her to push. If there's any evidence of fetal distress or persistent late decelerations, we should be prepared to go to C-section.
I've alerted the OR to be prepared in case we need to use it.
Great. I'll discuss this plan with Mrs. Keys when we're done here. What are her vitals right now?
Normal, just checked 15 minutes ago.
She's had no late deceleration since you recall.
Well, let's continue to monitor her. I need to know when she's complete and pushing so we can keep a close eye on her second stage. Any questions? Hey folks, we're going to do a C-section on Mrs. Keys because of persistent late decelerations which have temporarily improved. Mrs. Keys is a 27-year-old prima gravida at 41 weeks. Grant, do you have anything to add?
No additional anesthesia risk. I'm loading her right now with 10 cc's of 2% lidocaine. She's almost ready for surgical incision.
Lynn, is Peds on standby?
Page has been called. They're on their way. I've alerted Linda, the charge nurse, tonight. Can we do our surgical timeout now?
Go for it.
We have Michelle Keys, ID number 4562-3901. She's consented for a cesarean due to a non-reassuring fetal heart rate tracing.
Lynn, we do have a Michelle Keys, ID 456-23901 for C-section. Mrs. Keys, as a part of our safety check, please tell me why you're here.
I'm here for a C-section.
Thank you, Mrs. Keys. We're going to take good care of you. Great job, everyone. Can we discuss how things went today with Mrs. Keys? What did we do well, and what can we do better next time?
It was helpful for me to be brought in early. That allowed me to use a regional instead of a general anesthesia.
You're right, Grant. Lynn, what did you think?
It was great that Dr. Dean helped put the Foley in place while I did the count with Alicia.
Albert, this is a great example of task assistance. How was our communication today?
Excellent.
What leadership tools did Dr. Dean utilize? He huddled with the team before RN shift change, discussed the concerns and current status of Mrs. Keys, established himself as a current situational team leader, and he verbalized the current plan of care. How did the nurses demonstrate leadership? They huddled at shift change to discuss high threats, even with competing tasks and distractions. They prompted the timeout checklist and offered valuable feedback during debrief. Was conflict resolution needed? Janet's use of the 2-challenge rule was accepted and acted upon by Dr. Dean. What leadership strategies did Dr. Upton employ? There was a huddle for emergent need to perform a C-section, the pre-procedure briefing checklist used, included the patient in the timeout, conducted a debrief to recap the event and for lessons learned, empowered team members to speak freely and share team workload. Within this module, we identified some barriers to effective leadership. Some tools and strategies were introduced to overcome these barriers. The outcomes of effective leadership are a shared mental model, adaptability, team orientation, and mutual trust. Effective leadership in teams results in increased mutual trust, better developed common understanding among team members through information sharing, quicker adaptation by the team to changing situations through an improved ability to predict and anticipate, better utilization of resources, increased ability to learn from situations in patient care, improved climate of teamwork developed through praise, encouragement, feedback, and empowerment. Leaders have an impact on team effectiveness by ensuring that all changes in information are shared and understood by team members. They also ensure that teams and team members have the resources necessary to perform the tasks required. Leaders must ensure that information sharing, monitoring, helping, and other team actions are taking place by reinforcing shared mental models and by modeling actions for team members. Leaders must provide team members with the appropriate human and material resources to perform. Facilitating team actions aids in the development of shared mental models, while managing resources ensures that teams can be adaptable when necessary. Team leaders must ensure information is being shared, all team members have the resources they need to do their job, the situation within the work environment is continually monitored, and appropriate behaviors are modeled and reinforced across the team. Empower team members to speak freely and ask questions. Utilize resources efficiently to maximize team performance. Balance workload within the team. Promote and model teamwork. Delegate tasks or assignments as appropriate. And conduct briefs, huddles, and debriefs. What teamwork actions will you begin to implement?